I'm Dr. Kristina Menchaca, PGY3 at UM. My research topic today is outcomes of octogenarians and nonagenarians with low SD scores after transcatheter edge-to-edge mitral valve repair. So mitral regurgitation is the most prevalent form of the valve disease in developed countries. Secondary functional mitral regurgitation, primary degenerative MR became the most common mitral valve pathologies in the geriatric population. Although surgical repair or replacement of the mitral valve is the preferred for a patient with a low STS score, however, age is actually associated with a high risk of surgical adverse events. It's independent risk factor. So in this study, we actually observed outcomes of octogenarians and nonagenarians with low ST scores who were referred to transcatheter edge-to-edge repair. In this study, which is a retrospective cohort study, we included 127 patients. All of them underwent transcatheter edge-to-edge repair. We divided patients based on their STS scores and age. First group was consists of octa and nonagenarians with low ST scores, and we compared them to the patients who were younger and had like high STS score, because usually they're the one who are referred for transcatheter edge-to-edge repair. And there was no any difference in terms of their gender or prior diseases such as stroke, PID, diabetes, and ejection fraction and other characteristics. And then in the end, we assessed the outcomes, and that was total in-hospital stay, mortality, and also MR reduction after transcatheter edge-to-edge repair. And our results were next. So we found that there was no difference in terms of reduction, the severity of MR, total in-hospital stay, and also survival between those two groups. And that both groups actually had equally, exhibited reduction in the severity of MR, and also average total in-hospital stay and survival was 100%. So both groups had equally good outcomes. And going to our conclusion, transcatheter edge-to-edge repair performed in octogenarians and nonagenarians with low STS scores had equal effectiveness and outcomes compared to patients with age below 80 with high STS scores, and this should warrant more studies in the future regarding the potential benefits of referring octogenarians and nonagenarians to transcatheter edge-to-edge repair, regardless of their STS scores versus surgical replacement or repair of the mitral valve. Thank you.
All righty, thank you very much. Is there any questions out in the virtual audience? All righty, well, thank you. And it looks like we can go ahead and move on to our next presentation.